If you're someone who struggles with anxiety, you've likely heard of a medication called Alprazolam. Commonly known by its brand name, Xanax, this medication is often prescribed to alleviate the symptoms of anxiety and panic disorders. But what you might not know is that Alprazolam is a highly addictive and potentially dangerous drug that should be approached with caution. With the rise of opioid addiction in the US, it's more important than ever to understand the risks associated with prescription medications like Alprazolam. In this video, we'll explore the truth about Alprazolam, including its side effects, potential for addiction, and the importance of responsible use. Whether you're considering taking Alprazolam or simply want to be more informed about this commonly prescribed medication, watch on to learn everything you need to know. What is Alprazolam? Alprazolam is a prescription medication that belongs to a class of drugs called benzodiazepines. It works by enhancing the effects of a neurotransmitter in the brain called gamma-aminobutyric acid, GABA, which helps to reduce anxiety and produce feelings of relaxation. Alprazolam is commonly prescribed to treat anxiety disorders, panic disorders, and anxiety associated with depression. It is also sometimes used to treat insomnia and other sleep disorders. How does Alprazolam work? As mentioned earlier, Alprazolam works by enhancing the effects of GABA in the brain. GABA is a neurotransmitter that has a calming effect on the nervous system. By increasing the levels of GABA in the brain, Alprazolam helps to reduce feelings of anxiety and produce a sense of relaxation. Alprazolam is fast-acting and is typically taken on an as-needed basis. Alprazolam uses. Alprazolam is primarily used to treat anxiety disorders, panic disorders, and anxiety associated with depression. It is also sometimes used to treat insomnia and other sleep disorders. Alprazolam is a short-acting medication, which means it begins to work quickly but also wears off quickly. This makes it an effective medication for treating acute symptoms of anxiety and panic attacks. Alprazolam side effects. Like all medications, Alprazolam can cause side effects. Common side effects of Alprazolam include drowsiness, dizziness, headache, blurred vision, dry mouth, and difficulty concentrating. Some people may also experience nausea, vomiting, constipation, or changes in appetite. These side effects are usually mild and go away on their own within a few days to a week. However, some people may experience more serious side effects from Alprazolam. These can include confusion, depression, memory problems, difficulty breathing, or an irregular heartbeat. If you experience any of these side effects, you should contact your doctor immediately. In rare cases, Alprazolam can cause an allergic reaction. Signs of an allergic reaction include hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. If you experience any of these symptoms, seek emergency medical attention. Alprazolam addiction and withdrawal. One of the biggest risks associated with Alprazolam is its potential for addiction. Because Alprazolam works by enhancing the effects of GABA in the brain, it can produce feelings of euphoria and relaxation. These effects can be highly addictive, especially if the medication is taken in larger doses or more frequently than prescribed. Over time, people who take Alprazolam may develop a tolerance to the drug, which means they need higher doses to achieve the same effects. Withdrawal from Alprazolam can be difficult and even dangerous. Symptoms of withdrawal can include anxiety, irritability, insomnia, muscle pain, and seizures. Because of these risks, Alprazolam should only be taken as prescribed by a doctor, and should never be stopped abruptly without medical supervision. Precautions when taking Alprazolam. If you're considering taking Alprazolam, there are several precautions you should take to minimize your risk of side effects and addiction. First, be sure to tell your doctor about any other medications you're taking, including over-the-counter medications and herbal supplements. Some medications can interact with Alprazolam, increasing the risk of side effects. You should also avoid driving or operating heavy machinery while taking Alprazolam, as it can cause drowsiness and impair your ability to perform these tasks safely. Additionally, you should avoid drinking alcohol while taking Alprazolam, as this can increase the risk of side effects and addiction. Alprazolam dosage. Alprazolam is typically prescribed in doses ranging from 0.25 mg to 2 mg, depending on the severity of the symptoms being treated. It is usually taken 2 to 4 times per day, as needed. However, it's important to follow your doctor's instructions carefully and not to exceed the recommended dosage. Alprazolam and pregnancy. If you're pregnant or planning to become pregnant, you should talk to your doctor about the risks of taking Alprazolam. Alprazolam has been shown to cross the placenta and can potentially harm a developing fetus. Additionally, Alprazolam can pass into breast milk and may harm a nursing baby. If you're breastfeeding, you should talk to your doctor before taking alprazolam. Alprazolam interactions with other drugs. Alprazolam can interact with other medications, including prescription medications, over-the-counter medications, and herbal supplements. Some medications can increase the effects of alprazolam, while others can decrease its effectiveness. Additionally, some medications can increase the risk of side effects or addiction. Be sure to tell your doctor about all medications you're taking before starting alprazolam. Conclusion. In conclusion, alprazolam can be a valuable medication for individuals struggling with anxiety disorders, panic disorders, and insomnia. Its effectiveness in managing these conditions has been well documented. However, it is crucial to approach the use of alprazolam with caution and under the guidance of a healthcare professional. One of the primary concerns with alprazolam is its potential for addiction and dependence. This medication belongs to a class of drugs known as benzodiazepines, which have the potential to be habit-forming. Therefore, it is essential to strictly adhere to the prescribed dosage and duration of treatment to minimize the risk of developing a dependence on alprazolam. Furthermore, alprazolam can cause significant side effects if not taken as directed. Common side effects include drowsiness, dizziness, confusion, and impaired coordination. It is important to be aware of these potential side effects and to report any unusual or severe symptoms to your healthcare provider. Before considering the use of alprazolam, it is crucial to have a thorough discussion with your doctor. They will assess your medical history, evaluate the severity of your condition, and determine whether alprazolam is the appropriate treatment option for you. They will also discuss the potential risks and benefits of the medication, ensuring that you have all the necessary information to make an informed decision. Once you and your doctor have decided that alprazolam is the right choice for you, it is vital to follow your doctor's instructions carefully. Take the medication as prescribed, and do not exceed the recommended dosage. Do not share your medication with others, as it is specifically prescribed for your unique condition. If at any point during your treatment with alprazolam you have concerns or questions, do not hesitate to reach out to your healthcare provider. They are there to support you and address any issues that may arise. By approaching the use of alprazolam with caution, following your doctor's instructions, and maintaining open communication, you can minimize the risk of side effects and addiction while maximizing the benefits of this medication. Remember, your health and well-being are of utmost importance, and your doctor is your partner in ensuring a safe and effective treatment journey. Thanks for watching.